Hi, everyone, and welcome to Hi-Fi Health News. I'm Erica Grotto. Today, we're talking about health insurance, and specifically, how to choose which plan to go on when you and your spouse are both eligible for health insurance through your job. In most cases, it makes sense to have everyone in the family, both spouses and children, on the same plan, but not always. So let's get into it. First, assess your current healthcare needs. If you have a family member who requires a lot of healthcare services, it may make the most sense to go with the plan that has a higher premium and a lower deductible. You're paying more up front, but you're saving money down the line. On the other hand, if a low premium is something that's important to you, then you can go with the high deductible health plan, but in that case, you'll probably want to look into a health savings account or a flexible spending account to help cover the cost of what comes up. Here's a refresher on those accounts.
Health savings accounts, Erica, from a tax perspective, for HSAs, contributions are tax deductible or pre-tax if made through payroll deductions, and earnings grow tax-free if you invest those earnings. Now, withdrawals under HSAs are qualified. Withdrawals are for qualified medical expenses, and those as well are tax-free. Under FSAs, flexible spending accounts, contributions are pre-tax, and they reduce that taxable income and save money on payroll taxes. They can be used for medical, dental, vision expenses, including copays, deductibles, prescriptions, and over-the-counter items.
In addition to assessing your current needs, think about anything you might have coming up for the next year. Maybe you need a surgery or have a treatment coming up, or even a pregnancy. In that case, you might want to consider dual coverage, which means both spouses' health insurance pays for your care. But keep in mind, that's 2 premiums and 2 deductibles, so consider that carefully. Something else to know with dual coverage is that if you have children, one plan is the primary plan, meaning it pays first, and you don't get to choose which plan is the primary. Whichever spouse's birthday comes first in a calendar year is the primary plan. Finally, consider the big picture when it comes to your premiums. In some cases, you may be paying more to put your spouse on your plan if your spouse is eligible through insurance through their employer. Your employer also might place restrictions on their coverage. On the other side, your employer might offer a financial incentive not to put your spouse on your plan. Look at all of those things together and decide what makes sense for you. That's it for us today. I'm Erica Grotto from Hi-Fi Health News. Thanks for watching.